So this is another discharge letter, basically the continuity. EJ ko, just the same letter. I hope you've used the same logic here. All good. It's not going to be Mr. John. It's going to be Mr. Webb. Whenever you use Mr., it's better to use the surname of the patient instead of the given name. All good there at the top. Mrs. Sheila Dyer, all good. Age, date of birth, if given. It has no value anyways because the patient is returning to the same place where the patient came from. So don't need to be concerned about date of birth and age here. But if the age has to be written, it has to be written in the introduction of the letter, remember? Don't put the age in RE part anymore. I'm writing this letter to discharge Mrs. Dyer, a 72-year-old widow who was admitted and managed for left ischemic stroke, ongoing hypertension, and okay, dyslipidemia. That's not truth. The patient had dyslipidemia diagnosed way back, So you do not need to mention in the introduction of the letter. Dyslipidemia is not the reason why the patient was admitted here. It was because of the stroke the patient was admitted. So remove the ongoing hypertension, remove the dyslipidemia, and put it in the second paragraph. It's better to keep the introduction of the letter clean. Just write who was managed for left-sided ischemic stroke. That's it, finished. Ongoing hypertension can be mentioned somewhere else. But even if you have it in the introduction of the letter, it's not going to matter that much, to be honest. It's still okay. Mrs. Dyer presented to Barville Public Hospital on 10th March, where she received immediate treatment of tissue, plasminogen activated, and supplemental oxygen. For current status, there is no any. No any doesn't exist in English. It's a Nepali thing. Only we Nepali people, we do this. No any doesn't exist, remember. There is no sign. Just we don't need any there. There's no sign. There are no signs of swallowing deficit and overall. And she overall has a good physical assessment. Therefore, she has been deemed fit for discharge. Okay. All right. During her hospitalization or BMI, why not to introduce a main concern? I mean, what you've done in the second paragraph already is not bad. Why not to introduce one more statement there that says, what is it? The main concern. What do you think is the main concern? You can introduce that in the second paragraph. Arranging the information in the second paragraph, in the third paragraph. The ease and the comfort with which you put the information up front, that's somewhere around the second paragraph, is what matters. So here it's same as well. So whatever you've done is fine. Maybe add the main concern. The main concern is that she has ongoing aphasia and apraxia, along with upper extremity weakness, because of which she finds what was that, dressing, activities of daily living hard, difficult. Yes, physical therapy is ongoing, and the language therapy for aphasia and apraxia is also going on. So the therapy can be mentioned somewhere else, but it's always good when you insert the current status of the patient. Of course, you've written that the patient has good physical assessment. I have no complaints, but adding a main concern there, I have already told this in our previous sessions that adding concerns can be subjective. You can change whatever you want there. I may feel that a certain information should be the main concern. Maybe you may feel certain information is the main concern. So try to put something there. Okay. Anyways, you put it in the third paragraph. The difference is that if you're putting in the third paragraph, it's not a lot of difference, but putting things in the second paragraph, of course, has more value compared to the third one. During her hospitalization, her BMI was noted as 38, and aphasia and apraxia were present. For that management, she was recommended for Mediterranean. No, that's wrong. The management that you've written here for that management means you're talking about the management of BMI, you're talking about the management of aphasia, you're talking about the management of apraxia, you're also talking about the management of upper extremity weakness. Hey, okay, there's a comma. Okay, so what you do is she was recommended. We do not need four. Mediterranean is the area, is the region, so it's capitalized M. Put language therapy first and then regular physiotherapy. In that way, BMI is relatable to Mediterranean type diet. Then aphasia and apraxia that we have, language therapy is related to that. And for upper extremity weakness, physiotherapy is there. Now, where is the difficulty? You must have noticed on the question paper on the case note that she has difficulty doing activities, doing her daily routine things. So you need to mention that in the second paragraph as well, because the patient is returning to the same place where the patient came from. So you have to make the reader of the letter aware so that these are the ongoing issues. Yeah. Regarding her discharge plan, the dietitian has advised ADVICE will never have ED. It's ADVICE is a noun form, and noun form never takes ED with it. It's only the verb form that does. So replace that C with S. Has advised her to reduce BMI. Her medication BP, expanded blood pressure, pulse rate, respiratory rate, and heart rate should always be expanded. Yeah, along with the frequency at which medications are prescribed, right? OD, BD, TDS, those things have to be expanded as well. So must be monitored, as well as diabetes and depression should be screened. She needs to be encouraged for leisure and social activities. Her neurology consultation has been dated. Okay, makes sense. It's around 310, but certain information still missing. It's a C plus. Okay, let's see the next letter. Okay, we all good. No issue. We've talked about this. No age in RE part. We talked about this yesterday. We talked about this the day before also. Remove the age from RE and insert that into the introduction of the letter. The current health C should be small. I'm writing to update. That's a very good thing. You're writing to the person who sent the patient. So yes, update is also a way to express in a discharge letter. So I am writing to update the current health status of Mrs. Dyer, who has been diagnosed with left-sided ischemic stroke and middle cerebral artery. It's not actually. It's a left-sided ischemic stroke of middle cerebral artery. She's being discharged today and requires continued care. Okay, makes sense. Mrs. Dyer was admitted on 10th March, capital M for the month, with the aforementioned diagnosis on admission. She was treated immediately with tissue plasminogen activator and oxygen supplement, SCPPL. That's wrong spelling of supplement. She has been advised to take, no, you need to add other things as well in the second paragraph. You need to talk about the ongoing issue. You should at least write the reason why the patient is being discharged. That is on assessment. Yeah. So you can give a description that during approximately 2 months of hospitalization. That's around 2 months, isn't it? That's presented on 10th March and it's already May 12th. So 10 March, April, and then May. Two or not approximately 2 months, over 2 months. You can write. So Mrs. Dyer was admitted at, what's the name of our hospital? You can put the name of our hospital if it's given. Admitted for over 2 months, where initially, after her presentation, she received plasminogen activator and oxygen supplement. Yeah. During this course, she also received blah 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 blah. However, on today's assessment, it was found that her situation or condition is fit or considered suitable for discharge. Therefore, your care is needed. You can put like that. You should always, in the second paragraph, tell the reason why the patient is being discharged. Okay, during hospitalization, Mrs. Dyer has shown a good prognosis. However, she still experiences upper. Okay, you've written like that. Mm. Okay, along with aphasia and apraxia, therefore, a small t after comma has been encouraged to do stretching, and you cannot use ampersand, the ampersand and sign you cannot use, and also language therapy, which needs to be, which need, which need. Okay, correct. Upon discharge, she was recommended Mediterranean and capital M diet due to her current body mass. You do not need to expand BMI. Please monitor her blood pressure. Please make sure. Please ensure that her targeted blood pressure is this and cholesterol is this. Please note she has, no, write it in the same line after 70 mg. It would be greatly appreciated if you could monitor her regarding ongoing treatment and provide continued care. There's something missing in this. See, the last letter that we checked, Poonam's letter, you did not talk about the cholesterol and you didn't talk about the target uh, blood pressure. Yeah, that's another content blunder. Here in your letter, um, wait, how long? Okay. So what is muscle weakness or left-sided muscle weakness causing her? Add that as well. She's facing a bit of difficulty, right? You can add that. Second paragraph doesn't make sense. You have to add things to it to be suitable for a basis of discharge. You've just mentioned a little bit of management here. And we also have to mention the ongoing hypertension somewhere in the second or third paragraph. Here, Poonam had written in the introduction of the letter. That's also okay. Um, all right. Let's see the next letter. I'll tell you. We'll have a discussion. Wait. So the date here at the top is going to be 12th May 2000 and I think 18, right? Don't worry about that because on the examination day, the date will be the same as the day when you're sitting for the examination. So date is not much of a concern. I'm writing this letter of discharge. Mrs. Sheila Dyer, a 72-year-old female who is recovering from a left-sided ischemic stroke and requires continuous care and management from your facility. Okay, makes sense. Ms. Sheila Dyer was presented, not was presented, always presented. Was presented means somebody else made her present in the hospital on 10th March with the diagnosis of this. And how can the diagnosis be middle cerebral artery? It's like, the diagnosis is femur. It's like the diagnosis is biceps. That's wrong, isn't it? A stroke. Diagnosis of stroke off MCA territory. Middle cerebral artery is the most common place where strokes can happen, right? So that's why you have to write that. And she was immediately managed with C. This is the same thing you've made mistake. The second paragraph has no weight. During hospitalization, Miss Dyer had upper extremity weakness. Not had. She still has. Some muscle weakness in her right arm and difficulty with daily activities for which she has been initiated to perform. Yes, very good. Such as stretching and strengthening exercises, keep it plural. She has been provided with language therapy for aphasia and apraxia. Both. That's a comma splice after apraxia. So a therapy for aphasia and apraxia that needs to be continued after discharge. After all, she has good physical progress overall. Later, Miss Dyer's nutritional assessment was done, which recommended. Nutritional assessment recommended, or later, Miss Dyer's nutritional assessment was done. Therefore, Mediterranean type diet was suggested. That made her lose 5 kg, considering her BMI of 38. Yeah, right like that. The sentence irregular, Mediterranean's M is going to be capitalized. Uh-huh. Closing. Where is your closing? You don't have a closing in your letter. That's during hospitalization, there's also going to be a discharge plan, and after the discharge plan, there's going to be a closing of a letter. You don't have a closing. It would be appreciated if you could monitor her medication and blood pressure at, I don't know. I would be appreciated if you could monitor her medication and blood pressure is kept under 140 by 90 and LDL kept under 70 removed should be reduced from there. Please and kindly both have same function. Please encourage her to participate in leisure and social activities. Please note she has a okay. Your letter doesn't have a closing. Your second paragraph has no weight. Maybe you could have merged not everything from during hospitalization, but the ongoing issue, the main concern because of which you're writing the reader, that is aphasia, praxia, and then upper extremity weakness. You could have mentioned that somewhere in the second paragraph. You don't have a closing, it doesn't comply with the Format set by OET, but it's not bad still. All right, let's see. Next letter. Let me download all the letters. Just a sec. All right. Yeah, there you go. One more letter. Okay, all good. You should not be writing age in RE part. I've told this before. I've told it yesterday. I've told it the day before as well. Don't write the age in RE part. Mr. John Webb, it's going to be. We talked about this yesterday as well. Mr. John Webb, and then you write manager, and then you write Barville Nursing Home. Yeah. It's 12th May 2018. Age in the introduction of the letter. Please no, don't put the age there in the RE. This letter will introduce Mr. No. That's wrong. You're not introducing the patient. It's like you're introducing me to my mother. Yeah, that's wrong. Who is presently recovering from left-sided ischemic stroke. Makes sense. The second half, she requires your ongoing care and management after being discharged. Okay, makes sense. Put the change it a little bit instead of introduce. Why not write update? That would be more appropriate. Mrs. Dyer was admitted to Barville Public Hospital. I love when somebody writes the name of the hospital where the patient was admitted on 10th March due to stroke associated with hypertension and dyslipidemia, for which very good. She was treated, sister, not she treated. She treated means patiently afule treat good, right? Was add was there, and then it becomes passive voice. However, she has some muscle weakness and difficulties in daily activities. Her current BMI is 38, and she has oh yes, this one's I completely forgot. It's such an important thing to mention about the mild depression that's ongoing, right? No. She has a mild depression. Psychiatrist visit also is recommended, isn't it? We'll check it out. Wait. The good part is that she has mentioned the ongoing activities here during hospitalization. Mrs. Dyer was commenced on stretching exercise to promote strength and recover along. Very, very good. But why don't you write aphasia and apraxia? Why don't you write? I mean, it's going to be cherry on the cake. During hospitalization, Mrs. Dyer was commenced on stretching exercises to promote strength and recovery, considering her upper extremity weakness, along with language therapy for aphasia and apraxia. Aphasia. It would be greatly appreciated if you could take over the care of Mrs. Dyer. It is necessary that she shall continue physiotherapy for a speedy recovery. Don't use speedy. Speedy is not a formal expression. For an optimum recovery. Yeah, right, optimum. Please note that she has neurology consultation on this, and screening for diabetes and depression. Yes, that's why you have to put the depression. And please monitor if she is taking prescribed EDUNs, their medication like aspirin and antihypertensive. Why not to write particularly which antihypertensive it is? This letter, no, we don't do this. Your letter doesn't have a closing again. See, you need to have a closing. We talked about this, right? You clearly are capable of writing. I see that. You are able to twist and turn the words in your benefit. This letter is your own expression. Let me see. The second paragraph is self-explored. Third paragraph is well associated. The funny thing is, this is going to pass. The letter is still going to pass, although it doesn't comply with anything that the OET recommends. Please contact me with any queries. That is not counted anyways. Relevant with spelling wrongs. Remove that all of relevant things. It's not given on the paper, question paper. That means on the case notes, we don't include that. What I want is that we talked about this. There has to be a closing statement, like a movie ko ending dosto. We need to have like in light of the above. or considering the above, or something like that, like a milder form, in light of the above, kindly ensure or kindly manage Mrs. Dyer as you deem appropriate, something like that. Just add that statement. This is 320, 330 still. Can you imagine what would have happened if you had written it well? Introduction change a little bit there, ongoing hypertension. Now, seeing what did you do with the blood pressure? That has to be kept under 140 by 90, and the lipid profile, that should be kept less than 70. Yeah, these are the places where you have lost points. That's a content loss. That's a content loss. This letter had a capability of getting somewhere around 390, 400. That's very high B band, but you've missed certain content, and the way you're expressing yourself is still not suitable how the OET recommends. But still, I see that you have your own style of writing, and I appreciate that, and I suggest you to continue doing this. Just few information missing. Can you please rewrite and send it to me on the personal chat, adding the things that I've told you to add? I'm sure that your letter is going to get a higher B band. Good letter. Um, so you guys must be noticing, yeah, out of all the letters that we've checked, the fluency and uh, the connection that whose letter was that? The last one? It was Sumina's letter. The connections that you found, this for that, that is for this, that is always appreciated by the assessors. So out of all the letters we've checked, your Sumina's letter is going to get the highest, despite errors. Why? Because she is trying to transform the note. Certain contents are missing. Of course, I'm going to deduct the points, but still it's going to win out of all the letters that we have uh, edited. Let's go see the notes. Yeah, important things. So ongoing hypertension, of course, the patient has been hypertensive all along, isn't it? So no surprise, but we're still recommending C. So social background doesn't matter. You see, 2015, the patient has already been diagnosed with dyslipidemia, right? We don't care about this ankle fracture and everything. TPA, maybe you can mention, you can not mention. That's also your choice. Yeah, anything extra that we've added needs to be taken care. And then this thing's very important. Phase apraxia, upper extremity weakness, and what is that muscle weakness causing the patient? The issues with dressing, showering, toileting, right? Add that as well, and therefore physiotherapy has been commenced for that, isn't it? Stretching, that includes stretching and strengthening exercises. Then we have a Mediterranean type diet that has been recommended considering her BMI, and she has already lost 5 kg during 2 months of hospitalization. Language therapy for aphasia and apraxia. Good physical progress overall is the reason why the patient is getting discharged. And then we have neurological consultation. They've given it at the wrong place for you to fall into the trap. You can put it in the discharge plan. In the discharge plan, we have the blood pressure that should be kept under 140. We need to also consider the cholesterol level that should be kept under 70. And then the dietitian's advice to reduce BMI. And then there has to be continuation of physio and language therapy, screening for depression. And everybody has forgotten this encouragement in leisure and social activities, considering her ongoing depression since the demise of the husband. Add that as well. So all of your letters were very short. We can add encourage leisure and social activities. Basically, as a nurse, we are urging the reader of letter, that is Mr. John Webb, to make sure that he adds something to the patient's ongoing activities to counter depression. Add that as well in the goal in the closing, not closing. I mean in the what is it called? Discharge plan, right? So associated writing. It has to be associated, right? LDL goal is given there, atorvastatin as well. So make sure you add. We do not necessarily need to write all the medications here. They're talking about the compliance. See, they're talking about monitor compliance of all the medications, right? You can talk. So in one statement, we can give that aspirin, naltrexone, metprolol, and then atorvastatin and anticoagulant have been given and has to be monitored. So you can also guess like this. You see the patient has hypertension. Enalapril, 2011. You do not need to talk about enalapril. You see dyslipidemia. That means atorvastatin is for dyslipidemia, right? If you use a nursing mind, so these have already been ongoing, and then after that, whatever the medications we have, aspirin is also for blood pressure, obviously. Enalapril, metprolol is also for blood pressure. They all are for blood pressure, basically. So yeah, just monitor medication compliance already is important. We do not need to specify which one and which one not. So the ongoing medications have to be monitored. Done. So find connection and write. If you cannot, I'll write it for you. Yeah. So second paragraph, simply what you have to do is that she presented approximately 2 months prior, or more than 2 months prior, or she has been hospitalized for more than 2 months after she presented on 10th March for sustaining a stroke, for which she was managed with this initially, but that is 2 months prior. So I would not write TPA and supplemental oxygen, to be honest. You can remove it. So those who have removed, that's fine. And those who have kept, that's also fine. But if you put TPA and supplemental oxygen, you can put initially managed. But the main concern there, you can introduce, yeah, she has been kept, but on assessment today, her physical progress has been considered good or satisfactory, therefore she's being discharged. But the main concern is that she has upper extremity weakness that is limiting her to do, or that is inhibiting her, that is keeping her from doing, that makes her difficult in dressing, showering, toileting, right? For which physiotherapy such as stretching and strengthening exercises have already been commenced, which still needs to be continued following discharge. So discharge plan ko kura, we can pull it up. It's not a problem. If the context is coming to prasanga mathine ayabane, you can write it there itself. Additionally, the main concern additionally, she also has ongoing aphasia and apraxia, for which language therapy has already been commenced and needs to be also continued. Keep that. And अरू concern पनि धेरै कुराहरू I would consider blood pressure and cholesterol also concern, considering her hypertension, considering her ongoing hypertension, it is suggested that her blood pressure is kept below this and her LDL kept below this. In this way, only few things are left for the discharge plan. You can write like that in the second paragraph directly, no issues whatsoever. Yeah. You can even put Mediterranean type diet. So during hospitalization, during course of hospitalization, whilst being hospitalized, she has lost 5 kg after being suggested Mediterranean type diet. Yeah, that's it. And Mediterranean type diet. Therefore, what is it? A dietitian's advice is needed further, but we have too many things in the second paragraph. Maybe 80, if it crosses 80, maybe change it to another paragraph. You can put it there. Also, you can put it at the bottom as well. So see, when you feel that, okay, I want to write about the BMI and dietitian's advice towards the bottom. If you feel that the second paragraph is becoming overwhelmed, you can write, it is crucial for a dietitian's advice to reduce her BMI, yeah, which has been initiated while being hospitalized, where she lost 5 kg already on Mediterranean type diet. You can put it in the discharge plan also. I mean, no matter where you write, it should not be that, you're talking about weight BMI in the second paragraph, and in the third paragraph, you're talking about Mediterranean type diet, and in the discharge plan, you're talking about advice to a dietitian or dietitian's advice. So there has to be connection. You have to find story. You need to be a good storyteller. You need to be able to write it properly with connection, no matter where you write. So I've told this before. The main concern is always subjective, but I feel that, her weakness and her aphasia and apraxia is the main concern. Also, She had a stroke, and you all know as nurses that stroke happens because of high blood pressure. Then put that in the second paragraph also. No, but if you think that no, I don't want to put that, you can put it in the discharge plan and bring BMI in the second paragraph. So no matter how you write, you have to show connection. Yeah. So everybody rewrites the letter. I'll have a look. Rewrites are sent to the personal chat. All right. Okay. Let's jump directly into speaking. I hope everybody's practiced. And I've already sent you the recording. That so again, whatever I say, whatever suggestions that I give, you should write down on the piece of paper and memorize. Remember, that's the way to go. Every day you should memorize a card. Just give me a second. There you go, guys. 3 minutes, prepare. So those who entered the class first will do the speaking. We'll wait for 3 minutes. All right. So we prepare A1, A4, B1, and B3. You have to focus. In this, it's very important that you focus on B1 and B3. So let's see how you guys do. Poonam, start. Poonam, we can start. Poonam, we can start.
Good evening, I'm Poonam. You're attending nurse from this hospital ward.
Hello. Hello. Hello, sis. Hello, nurse.
Uh,
Come on, continue. Oh, your network is down. Continue.
your CT scan had showed that you have a stroke. Do you have any idea what is stroke?
I don't know what stroke is. I was quite surprised when the doctor told me that I had a stroke. I always thought that stroke is something really big, and I'm very worried. So can you tell me more, please?
Okay, you don't need to stress about it. Let me explain it for you. It is a condition where blood clot blocks the flow of blood and oxygen to the brain. Do you get me?
Yes. So what causes stroke?
There are many leading causes. There are many leading causes of stroke. There are because of high blood pressure or high cholesterol level, smoking, obesity. By the way, do you smoke?
Yes, I smoke.
Yes, that's also one of the reason for getting stroke. And do you know how much kg you weigh?
Sorry.
Weigh?
Go on. Sorry.
Do you know how much kgs you weigh or
I
your
I
weight?
am around 90 kilos.
Mm, okay, that's also another reason for getting stroke. Mm,
Okay.
mm,
Done. Look at the criteria. Look at the tasks, and just follow the task.
um, for for the management, we are keeping you on the medication for today,
Mm-hmm.
and you might be required to have regular blood tests for the time being. Are you okay with that?
No, I get that we do, but I've heard that people who have stroke they can even die. I feel that I'm quite lucky. What do I need to do to prevent from another stroke happening in future?
Um, okay, I understand your concern. For the prevention, you need to watch for your weight and start decreasing your calorie intake, and you should exercise uh, more, and you should also try try to minimize your smoking habit and eventually quit it. It's gonna be better for your health in the future, and it's gonna reduce your hospitalization in the future. Are you understanding me?
Mm-hmm. Okay.
You uh,
Mm-hmm.
you don't have to worry about another stroke as you are already in safe hands, and doctors and nurses we are monitoring you very closely to prevent for another episode. Um,
Mm-hmm. Mm-hmm. Okay, stop. See, when you get confused about what to do when the patient doesn't say anything, you need to check with the patient. Do you understand me? Do you get me? Are you understanding me? Do you get whatever I've said so far? Do you have any questions? Then only they will ask you a question. You're not the only one who has to talk all the time. You have no attempt. Another thing is A4. Where's the A4? I'm really sorry that you've been hospitalized. Yeah, there's a truck driver given there. You could have talked so much about the truck driving, and we all know that what causes stroke: obesity, smoking, drinking, and lifestyle. You could have talked about stress. You could have talked about millions of things, and there could have been more B1 questions. How did it happen? When did it happen? How were you when it happened? Yeah. So B1 compromised, B3 compromised, A4 compromised. You didn't. Okay, E1 you did that. It did. So those questions are not there, and you're not checking with the patient. You're just waiting for the patient to say it. It's not going to happen in the exam. Do you get me? Do you have any question? Anything that's bothering? Okay. Be active. You're just keeping quiet. A4, A1, B1, B3 is gone completely. Okay, Sonisha, try.
Mhm. Hello, good afternoon. My name is Sonisha, and I'm one of the registered nurse working in this hospital ward. And today I'm attending you.
Mhm.
So today, as you are being discharged, so how are you feeling now?
I feel better. I feel that I feel better definitely compared to how I was.
So I hope you were aware about your condition that your CT has shown that you had a stroke. So do you have any idea what is a stroke?
I have no idea. I was quite surprised when the doctor told me that I had stroke. I always had a notion that stroke is something really big, and when the doctor told that it has happened to me, I was quite
Mhm.
shocked. Yes, but I don't know what stroke is. Can you tell me what causes stroke and how did it happen to me?
Definitely. Um, I can understand you, and I'll definitely tell you what it is. A stroke, it is a condition like in which clot blocks a blood vessel in the brain. Yes, and people with a stroke have different symptoms according to their position of clot in the brain. All right, and also, there are many risk factors that cause stroke, such as obesity, smoking, drinking, and hypertension, and also lack of exercise. All right, are you following me?
Yes, yes, I understand what you're saying. Yes.
Yes. Do you smoke?
Yes, I do.
Yes. So smoke is also one of the risk factor that can cause a stroke. So I think you should change this habit like slowly to to control this condition in you. All right.
Yes, I get. So I've heard that people can die because of stroke, and what should I do to prevent the next one from coming? Is that a possibility that I'll have one more?
Oh, I can understand what you are feeling right now. As yes, and there are different kind of medicine available to prevent this, such as warfarin, and your situation is stable with the medication, and I know you are worried that whether it will uh, it will uh, recurrent or not. Yes, but don't worry. As I told you, your situation is stable, and this can be managed. And but you have to focus on something like you should continue with your medication. All right, are you getting me?
Yes, I get that. Okay.
As and further with along with this that you doctors have ordered the regular blood tests that you need to follow, and also you need to be more monitor, yes, blood, your investigation and your medication, like to prevent another stroke. Are you getting me?
Okay. Yes, I get that. All right.
All right. And also, as uh, I'd also like to suggest you that, as you told me that you drink, and like you should limit the habit, and also like you should ensure to lose your weight and do an exercise. Small steps can take you a long way. You can continue with doing your exercise, and habit of eating healthy diet. That is also one of the best way to control your another stroke, or to prevent from recurrent of another stroke. All right.
Okay, I get that.
Okay. And now you are ready to be discharged. So if you have any other concern, or you want to ask anything,
No, I'm quite all right for now.
all right, then please now take your time, just relax, stay. I will make your paper ready to be discharged, and let you know when your paper will be ready. So till then, please take rest, and if you need anything or any kind of help, then just give us a buzz, and we'll be right here. Okay,
Mm-hmm.
take care. Thank you.
Very good. Yeah, this is the way it should be. Relaxed, calm. You could have asked a few more questions if you wanted. So what do you do for a living? You're a truck driver. Yeah. Patients a truck driver. So is it hectic? How often do you drive? Okay. Yes. Stress also can be a factor. And you said that you smoke as well. What about your drinking habit? What kind of food do you eat? There are so many questions you can ask. Yeah. So patient, of course, is going to say, I eat fast food because I drive all the time. I drive the truck. I smoke. I drink. So just give them a conclusion. Yes, that is the reason. Uh, Smoking, drinking, lifestyle, and eating habit contributes to stroke, and that's the reason why it has happened to you. But you don't necessarily need to be worried. You have been taken very good care by the doctor, and there are ways in which it can be prevented. I'm going to talk to you about that. So weight loss and everything. Yeah, it's not bad. That's the way you talk. Yeah, easy, relaxed. Okay, Sumina.
Good afternoon. My name is Samina. I'm one of the registered nurse working here
Nurses.
in this hospital. Nurse
Mhm.
in this hospital. As I was going through your chart, you had a stroke. How are you feeling right now?
I feel relieved. I feel better. Also very surprised, with the diagnosis, of course.
I know your concern. What do you do for living?
I am a truck driver.
Okay, you are a truck driver. Do you know anything about strokes as you are diagnosed with stroke?
I'm quite surprised I told you earlier. Yeah, I have no idea what stroke is, to be honest. Can you tell me more? What causes it?
Okay, I will tell you, don't worry. Um, Stroke is when blood clots blocks the flow of blood and oxygen to the brain, and these things happen. Do you smoke?
Well, yes, I do.
Okay, do you take alcohol?
Yes, I do.
Okay, if you smoke and if you take alcohol, then you have to minimize these things because it can lead you in future for another stroke. So you have to minimize this alcohol and smoke things. Okay,
Okay, I get that. All right.
okay. Um, the doctor has prescribed you to take warfarin 6 mg per day regularly. So you have to take that medication daily uh, to uh, to to prevent from stroke.
Hmm. Okay, well,
So
I've heard
you
that
have,
people can die of stroke. Is that true? And
yeah, yes, some people died from stroke, but um, your stroke is minor, so you don't have to worry about that. Okay.
hmm.
Now you are in a stable condition and your stroke is a minor. It can be cured from medicine, so you don't have to worry about that so much. Okay, do you get my point?
Hmm. Okay, I
In few
get that.
Yes, in future, to prevent stroke, you have to do daily monitor of your blood pressure, and you have to do blood test that the doctor already I think told you about that. And yeah, you have to do just monitor your blood pressure, blood test to prevent another stroke. So yeah, do you getting my points?
Are you
Are you
getting?
able to follow me?
Okay,
Okay.
yes, yes, I get that.
um okay. And uh, to and you have to do some exercise. How often do you do exercise?
I have no time to do exercise, to be honest.
Okay, but I can understand you are truck driver. You might be very busy, but you have to take time to do some exercises in regular basis, and you have to take care of your diet also,
Hmm.
and yeah, you have to like take care of your diet. How often do you eat junk food?
That's premeditation, but I almost always and all the time I eat junk food because I'm driving every day and I have no time to eat home food.
Okay, I understand your concern, but from now on, you have to eat healthy foods and drinks, and you have to limit your alcohol and smoke. And to prevent another stroke in future, you have to check your cholesterol level and blood pressure. Um, are you able to follow me?
Okay, yes.
Yeah, you have to do these kind of things. Do you anything you like to ask me? Is there anything?
No.
Okay, when your discharge paper will be ready, I will tell you.
Hmm.
Okay,
Hmm. Stop. Sticks, huh? You could have.
thank you.
You cannot say that, do you eat junk food? That's like a leading question. Leading question means it's in your mind and you're putting it on patient. So instead of
Okay,
leading it, you can ask, tell me about your lifestyle. I can see from the card that your height and weight is not in correct proportion. Your weight is around 96 kilos. We can tell the patient, and the patient himself is going to say this instead of you pushing it. Remember, that's called leading question. It's called D3 error. Check on uh, the criteria sheet. It's called a D3 error when you lead, when you already are premeditated and you move forward. That part. Okay, first of all, I'm really sorry to hear about your hospitalization. The good news is that you are stable and you're going to be discharged. This kind of things also should be added. We'll talk about it. Wait, let everybody finish. Swastika.
Hello, good evening.
Hello.
My name is Sustika Chand and I'm your attending nurse in this hospital ward. I will look after you. So, before proceeding, how may I address you?
It's a known patient, but anyways, my name is John.
Okay, John. Um, Can you tell me about your health issues?
That's completely wrong. It's a non-patient. You know everything about the patient. You cannot ask patient. You are there to talk. Ask the patient. That's the first thing that you're saying. You know, you can talk. Your A1's nature of interview went wrong. Try again.
Okay. So your CT scan revealed that you have a stroke. Am I right?
Yes, that's correct.
Okay. So can you tell me more about your health issues?
No. Okay, can you tell me more about stroke? I was quite surprised when the diagnosis was made. Can you tell me more about stroke? Can you tell me more about the stroke? Can you tell me more about the stroke?
Okay.
Mm-hmm.
Um, stroke is a condition where stroke is a condition where your um, blood flow has been blocked in your brain. So are you getting me, John?
Okay, I've heard that people can die because of stroke. So what are the chances of me having one again in the future?
Oh, first of all, I'm really sorry about your hospitalization, but you don't have to worry about that. You are totally fine now. So do you have some question?
What causes stroke and how to prevent it?
Okay. Uh, stroke causes due to a high blood pressure, diabetes, and high blood cholesterol level. So so that is the reason for stroke. So before that you before that can you tell me about your lifestyle?
Uh, be particular. My lifestyle is good, Vandinja patient.
Is it?
All right. Sabai wrong, bo. You're Milena. Uh, let's see. Sabina, you try. When when everybody's speaking, it's good that you note and all the comments that are given. There were three, four people in front of you. You could have learned from that conversation and you could have done a better conversation. You're talking in such a way that you're not even sure how to start the conversation when the patient is admitted in the ward. You do not need to ask the name of the patient at all. You're making like early blunders. Let's Sabina try.
Hi, good afternoon.
Hello.
My name is Sabina. I am one of the nurses working in this hospital ward. Today I'll be taking care of you. I was going through your reports and I realized that you went to do CT scan and now it has revealed that you had a stroke. Are you aware of that?
Oh yes, I was quite surprised, but I'm aware. Yes, when the doctor said I had stroke, I always used to think stroke is something very big.
Mm-hmm.
I have no idea what
Okay.
it is and what causes it.
Okay.
Can you tell me?
Of course, I will definitely explain you all about this. You are Joan, right? Can I call you Joan?
Yeah, sure.
Okay. So, John, stroke is a condition where your brain will not be having sufficient blood. Like it's a kind of brain attack thing, as we know that there's a heart attack, same like that. There's a brain attack. So there are like various causes of stroke. Before that, I would like to ask you a few questions. Will that be okay?
Yeah, sure.
All right. What about your diet? Can you explain me about your diet?
I eat fast food mostly.
Okay. And do you do exercises?
No, I have no time for that. I'm
All
too
right.
old for that.
Okay. What about your smoking and drinking habits?
I do smoke and drink.
Okay. And do you have any other disease like before you came to this hospital where you diagnosed with high blood pressure or heart problems or anything like that?
Yes, I have hypertension.
Oh, okay. Thank you for the information, John. So, stroke can be caused due to like various types of causes like this. It depends if a person has high blood pressure, then that might be a cause, or any other heart problems, then that also may contribute to stroke. Or sometimes our lifestyle and our diet and habits also contributes to it. As you mentioned me that you drink and smoke and you don't have any time for exercise, right, John?
Yes.
So it might be also a possible cause. You need to keep on monitoring your body, have a healthy diet, do exercise, and then if you manage your blood pressure also, and then we can avoid stroke from next time. Are you following me, John?
Yes, I'm getting you. Okay, so I've
Okay.
heard that people can die because of stroke. What are the chances
Okay.
of me having another one? And how
Mm-hmm.
do I prevent that from happening?
Okay, okay, John. I really understand your concern. You are really worried. However, now your condition is really stabilized with the medicines doctor has prescribed you. And now onwards, you need to take this medicine called warfarin, 6 mg every day, and it will help you to prevent stroke from happening. And then, as you are worried, like you might die, you will not be having such kind of issues. On top of that, you also need to do regular blood tests. Okay, John, are you getting me?
Uh-huh. Okay, I get that. All right.
Okay, so if you follow our guidelines properly, like taking medicines at time, and then also doing a follow up with doctors and taking your blood tests for various kind of things, then we will be monitoring your condition and we can prevent a stroke from happening the next time. Okay, John?
Mm-hmm.
And also, I'd like to let you know some information regarding the weight loss. As I just saw that in your case notes, doctor has mentioned that you have a pretty high weight compared to your height. Is that right, John?
Yes, that's correct.
Okay, so John, do you mind starting a little bit exercise every day and also like decreasing the amount of having junk food? How does that sound, John?
I'll try.
Okay, so you can just start a little by little, like, or you can start by walking or, starting a stretching exercise, and also if you start to take fruits and vegetables every day, that will also help you, okay, to lose your weight, and also it will prevent from happening the stroke also. Okay,
Okay.
John?
Yes, I understand you. All right.
Okay. And as you mentioned that you drink and smoke, and if possible, you can just gradually lower the amount of alcohol you take and number of cigarettes you smoke. That will also be really helpful for you to improve your health condition. And also, like, it helps to lower down your blood pressure. How does
Hmm.
that sound, John?
Yeah, that sounds good too. All right.
Okay,
Stop.
I hope.
Yeah, this is the way the conversation is done. So you can be curious, you can be inquisitive, ask many questions. We know that stroke happens because of high blood pressure, can happen because of smoking, can happen because of drinking, can happen because of profession, constant stress. Yes, many things. So you can make many questions and then come to a point and tell the patient this is the reason it might have happened, and there are ways in which it can be prevented. When the patient asks question, you can also give expressions such as, uh, that's a valid question, that's a genuine question, that's a good question. Don't overdo it. Once or twice you can do it through the conversation. And when patient is saying anything, it is better that you also respond, okay, I get you. That will also give you a D1 score. From the D1 criteria, being attentive, you're trying to show that you're attentive to the patients. Questions need statements, right? So it's a the A1's intro, the nature of interview. How could that be done? Simply, I've come to know from the card that you're brought here by ambulance and you had sustained a stroke. Are you aware of that? When you say, "Are you aware of that?" you also get point from E1, right? So today's conversation basically is going to be based on this, right? So do you have any idea what the stroke is or something like that? Or the patient already is going to start the conversation. That's the way to go, not how may I help you. If you do how may I help you, that's a blunder, remember. You're going there to talk to the patient at the time of discharge. Yeah? Make sure, don't ask the patient, how much is your weight? Because we have the card in our hand. Don't you know the weight of the patient? When the patient is admitted, we have it in the card. It's everywhere. In the progress notes, in the admission notes, we have. So we can already premeditate, make up a story. Your BMI is high, which means your height and weight, they're not in correct proportion. You're slightly overweight. That also can be a contributing factor. You told me that you smoke. You told me that you drink. And is it stressful to be a truck driver? How often do you drive? Do you go on a long journeys, long trips? The patient says yes. So maybe doing this for many years. And how long have you been a truck driver for? How long have you been drinking, smoking? So you've been doing this for over 20 years. These are the contributing factors. On top of that, you have weight. You have also gained weight. You also are slightly overweight or you're obese. So to prevent, the question that you asked about the prevention would be to modify the lifestyle, the foremost, and importantly, smoking and drinking, and then maybe you should add a little bit of activity, um, exercise or something that is going to control the future stroke. Losing weight also becomes crucial, right? That is the lifestyle modification, but medically, you need to keep repeating the blood test, and you're under warfarin. Are you aware of that? This medication, you have to be keeping, you have to keep taking this medication um, until it's reviewed by the doctor. And these are the ways in which you can prevent stroke from happening, something like that you can do. And if you have time left towards the end, most of you finished at 5, but still, sometimes there's a possibility that you can finish earlier. So you can ask, have you understood everything that I've said so far? Do you get me? Do you understand me? Is there anything else that needs to be further explained? If not, then I know, I understand, John, whatever the patient's name is. You're worried about stroke. So see, be positive about this. It has already happened. The good news is that your condition is well under control, and I have made you aware of all the things that you can do to prevent it. I hope you follow them. If you have any questions, you can always find me, right? Have a good day or something like that. So whatever I've spoken, please make a transcript of it and memorize. And Sonisha did very well. Sabina did very well. You can learn from the recording. Yeah. Be more curious. Never premeditate. Okay. Do you eat junk food? That's wrong. What kind of food do you eat? That's correct. Try to have open questions as well. Do you eat junk food? Do you smoke? Do you drink? Okay, if you start with do you smoke, then the next question should be what about drinking? So at least show the assessors that you're using open-ended questions in the beginning, initially. All right? Okay. I'm going to send you the homework. I'll tell you the homework in a while. All right? Please practice your speaking.